Suppose you injured your knee and you got an MRI and your physician said you may need surgery. How do we come to that decision? Well, let's look at a few factors that come into play. First, it's very important that we look at the knee model and discuss what is a cartilage injury of the knee. The first thing we need to do is make sure that when we're talking about the cartilage injury in your knee, we're talking about your meniscal cartilage. There's two types of cartilage in the knee. The articular or hyaline cartilage, represented by blue in this model, caps the ends of our bones with almost frictionless gliding that occurs during knee motion. When this is thinned or absent, that's when we get arthritis. The meniscus cartilage, on the other hand, is fibrous cartilage, a spongy, rubbery type of layer that acts as a shock absorber, as well as providing nutrition and some stability to the joint. We have two menisci, one on the inside and one on the outside of the knee, or the medial and lateral meniscus, respectively, on this right knee. If we look within the meniscus, there's three different zones. Often it's torn in the back side of the meniscus or posterior area, and you can imagine as you bend your knee and twist, this can really exacerbate symptoms. In addition to your age, there's three very important questions when it comes to meniscus injury. Did the pain come on slowly, or is there an acute trauma? The second, do you have any type of catching or locking in your knee, kind of like a pebble in the shoe? And the third, do you have any swelling in the knee, a kind of fullness that as you bend feels tight? Once we've established that it is your meniscus that's likely causing the pain, it's very important to look at what type of tear it is. And this is both with location of the tear and pattern of the tear. So let's take out one of the menisci and look directly at it from the top view. In terms of location, the tear can be in the anterior part of the meniscus, the mid or body of the meniscus, or the posterior part of the meniscus, called the posterior horn. It also can occur either on the inside or the outside. The outside in this model delineated by the black, where there's soft tissue attachments, and this vascular zone can allow for healing of tears in this area. Now let's look at tear patterns. We'll look at 5 different common tear patterns. The first is a radial split, demonstrated here. A radial split, as you can see, is more on the inner margin and would be less likely to be able to heal because of less blood flow, and is often trimmed or partial meniscectomy. A second example is one in which when looking directly down on the meniscus, you wouldn't see anything. But when I look from inside the knee, there's an inner margin or horizontal cleavage tear within the meniscus itself, almost like between 2 layers of plywood. These tears can often be stable and may not need surgery. The third pattern is a longitudinal or peripheral tear. This tear is out more towards the periphery and can be amenable to repair. Sutures in this area can close the tissue together and allow for the blood flow to create healing. The fourth type of tear is a radial oblique tear, such as this. This can create a hangnail phenomenon, which can catch and lock. It also can get caught out in the periphery of the meniscus in so-called gutter of the knee and be very painful. This can be delivered back into the knee and trimmed so as to decrease the symptoms. The final type is a large longitudinal tear with only small attachments on each side. This large tear can actually flip into the joint like this, a so-called bucket handle tear. And when that happens, it can cause locking of the knee and decreased range of motion. In summary, not all meniscus tears need surgery. I've got many players in the NFL who have meniscus tears and do just fine. It comes down to the 3 factors we talked about. Did you have an acute trauma? Do you have some swelling in your knee? Do you have mechanical symptoms such as catching or locking? If you've got these types of issues, then meniscus surgery can be very beneficial and help get you back in the game.